Hi there, Alan Reece with the law firm of Frank and Kraft. Sitting here today talking with Sandy Dietrich, a geriatric care manager with Alliance. Today we're talking about a specific type of care that's provided in assisted living facilities, what's commonly known as memory care. Hi Sandy, how you doing?
Good morning. I'm very well. Thank you for inviting me to be here today, Alan.
Well, it's always a pleasure to have you back.
Thanks.
So what is memory care? People have heard the term, they've seen it on the websites describing different types of care facilities. What is that and who does it serve?
Well, it's a very specific unit that, in simple terms, just offers a very safe and secure environment for anyone with dementia or Alzheimer's disease.
Okay. And what about the facility makes it those facilities makes them particularly good at taking care of people with Alzheimer's or dementia?
Well, what we find with dementia is that it's a whole different animal when it comes to finding caregivers because it requires such specific education. So we always want to make sure that the folks that are caring for our loved ones in this unit have a very special education,
Okay.
and they also continue to get ongoing education. I think that's very key here.
Okay. And they're also sometimes designed a little bit differently as well. Because I know that folks with Alzheimer's sometimes they wander at certain times, and so from what I understand, memory care units are also designed in such ways to help keep folks safe.
They really are. As we take a look at the types of reasons that someone may look to go to a memory care unit, in my experience, number one on that list is wandering. Suddenly, someone just goes right through a door and ends up either outside or in an entire different part of the building. We see perhaps someone is in a skilled facility receiving rehab, and, and all of a sudden there's a disruption in their sleep wake cycles, and we find them going from room to room to room in the middle of the night,
Mm.
and not really remembering where they are. Perhaps there's disruptive behavior. I had a fellow who um, literally, if left in an agitated place, would continue to escalate to a point where he eventually, would take a TV and throw it across the room.
Wow.
So if you don't have an educated person that can stop right here at the beginning of that agitation, then we see how quickly it can escalate if you're not in the proper setting. Also, with dementia patients, if suddenly they are beginning, and not suddenly, but we're seeing an increase in their urinary and fecal incontinence, that can be better managed in this smaller setting.
Okay. Where will you find memory care facilities? Are they always going to be in an assisted living facility, or I guess where will you find them? Where do they show up?
Um, in many different places. You can find them in what we call CCRCs, and it's a
Okay.
continuing care retirement community where people can come in that independent living setting, and it's an aging in place.
Okay.
As they need more help, they can go into assisted living, and then from there, if they choose to stay there, go on into a skilled setting.
These are the facilities that basically take care of the entire continuum of care from when you're completely independent to when you need a full scale nursing facility.
They do. And I think one of the benefits of that is if you go into an assisted living and end up in a hospital and need to go off to a rehab, you can come right back to your building and do that rehab under that same roof.
That's nice.
It is nice because the folks that are there can visit back and forth, and you feel like your family is actually visiting you.
Sure.
You've made a lot of friends there, so that there's that positive. But I've also worked with assisted livings that literally can be an aging in place.
Okay.
And when I say that, I mean that that facility allows supportive services to be coming in, whether that is skilled care, whether that is hospice, that can all happen in that assisted living home as well. There are so many differences in the types of care that are provided in different companies.
So, can you think of an instance where it would make more sense for someone to stay at a memory care facility or be in a memory care facility at an assisted living facility instead of going to a nursing home? What's the difference between the choices one would make between those two?
And sometimes we don't have a choice,
Okay.
and I say that kindly, but and again, if we're looking at someone in a skilled facility, they're not going to accept someone that is a wanderer or that has
Okay.
disruptive behaviors, because there is a specific unit with people that are very trained to manage that behavior.
Okay.
They literally can take this fellow I talked about before and see him down at this ground level of, I don't know, we're starting to see some agitation, he's starting to pace more. So let's remove him from this setting and let's move him over here to a very quiet environment until this de-escalates before it can create a problem.
Okay.
And they are the professionals who can say, you know, this person really doesn't do well in groups, so maybe they won't have him going to large group activities, but will manage him better with just a few.
Okay.
They're very skilled and perceptive with that. And I think the lovely thing about memory care units is that they are very home-like without the risks. You have this ability to bring in, and they encourage this, literally bring in the furniture, you know, bring in all the things that remind them of home. If you have someone who loved to crochet, bring that favorite bag with the you know, with the yarn and all of those things, so that they can see that and pick it up and feel it. I had a fellow once who was a conductor, and he trains were his life, and one whole wall in his room was devoted to different little train sets of all the different area trains and so forth that he'd worked on. So anything that can trigger, you know, positive memories for them. And the other thing that's very positive, I think, about memory care units are their ability to do activities well. There's a designated activity director, again, who is very qualified and has education in dementia patients, and so can design a program for that unit that allows them to be challenged each day. Not the typical bingo that we might see in the afternoon,
Mm-hmm.
but rather a newspaper on the table in the morning that can be picked up by one of the staff people, and, you know, reading a lead article and saying, wow, look what's happening here, and do you remember when, or what happened when, you know, and allow them to think back to that time frame of telephones. Instead of that iPhone 5, let's look at the type of phone that you had growing up.
Okay.
So triggering those kinds of things is always wonderful to see.
If someone's trying to find a memory care facility for a loved one, what should they be looking for? What are some good either resources to look at or things to keep in mind?
Many things to look for, and again, we do have these questionnaires that we give to our families, that they can literally have us go along to help them, or they can take these questions with them and ask the right kinds of questions to find the best facility for their folks.
Just want to say, so the questionnaires that Sandy's talking about, we're going to have those uploaded on Alliance's landing page on the AutoCare channel, so that's a resource you can access as a viewer. Okay.
I think in my experience, and this just happened within the past year, I had been following a sweet, sweet gentleman in Florida. His son lives in the Indianapolis area, and he called one day to say, I'd love to move Dad here to Indianapolis. I think it's time. And so we began with those questions of what types of things does Dad love? Well, he loves to walk outside. He loves to swim. He loves to go to church on Sunday. So finding a place that would afford him a chapel and church on Sunday and outdoor gardens that he could stroll, those kinds of things became so important. And so finding that place, the niche, so to speak, for your loved one, and you'll know it when you see it in the home-like atmosphere and the care and the love that comes from the support team is very evident.
Sandy, thanks so much for joining us and talking a little bit about memory care today. And thank you for joining us as well. If you have any other questions or concerns, shoot us an email at the Elder Care channel, or you can reach out to Sandy or me directly as well. Thanks for joining us.